Hi, everyone. Welcome back to another episode of Heart to Heart. As you know, this is Dr. Amri Mohammed and mine, Dr. Misha Gupta's little project that we like to do on the side. It's an IGTV series and also a YouTube series where we talk to today's cardiologists and other physicians about their journey through medicine and really just trying to get to know a little bit about them and their presence on social media. So today we are very excited because we have Dr. Antonino Di Franco, who comes to us from Italy. So Dr. Di Franco earned his medical degree as well as did his cardiology residency and fellowship training from the Catholic University of the Sacred Heart. During the last year of his cardiology fellowship, he moved to New York, where he completed research fellowship and advanced imaging training at Cornell. He went to publish over 100 papers in peer-reviewed journals such as New England Journal of Medicine and Circulation. He has won countless awards, such as being recognized as one of 2019's top 10 under 35 Italian excellences, as well as being elected Fellow of the Italian Society of Cardiology and newly Fellow of ACC. And currently, he serves as the Assistant Professor of Medicine at Weil Cornell School of Medicine. And he runs his own practice in Italy, where he's in his brand new office today. So, Antonino, thank you so much for joining us on our podcast. And, just to get started, we want to know a little bit about why you chose a field in cardiology.
Well, first of all, thank you for having me. This is a huge honor to be here. And so let's just get it started. So the interesting thing, I guess, is that I first wanted to study philosophy, but then I realized I wanted to have a more immediate impact on people's life. So I guess medicine could be the right choice. I for sure have to acknowledge that my very first mentor is my dad. He's an amazing cardiologist and he's a real role model. His dedication to his patients, to his work are just unbelievable. And he has always supported me at every stage of the game. And I'm really lucky to share this passion with him. Then, during med school, I was fascinated with cardiac physiology and also the diversity of career and options, lifestyle options that cardiology can offer. Cardiology as a field really spans through the entire spectrum of care, going from preventive to imaging to interventional to critical care. And sometimes in a single day, you can literally find yourself doing all of these things. Just to give a couple of examples, as an interventional cardiologist, you can bring people back to life during an heart attack. As an electrophysiologist, you can prevent potentially threatening arrhythmias. As a general cardiologist, for example, you can prevent people from having an heart attack or having a stroke before this changes their life forever. And doing advanced cardiovascular imaging, you look inside the body, you look inside the heart, you can make very complex diagnoses, suggest the most appropriate surgical strategies, and also tailor the most appropriate therapy for that single patient. These are just a few examples of how cardiology lets you impact a single patient. But if you do research instead, you can potentially impact the life of thousands of patients who are located anywhere in the world and who are people who are not yet patients, but who could be patients in the future. So I guess these are probably just a few, but probably the main points and the main reasons why I got into cardiology.
Well, that's amazing. I mean, you don't have to sell it to us, but, for our audience out there, like Dr. Di Franco said, it's just, there's such a variety within the field and it continues to grow, right? And that's the beauty of, I think, being in a field, medicine in general, that's so interconnected with research and with interventional technologies is that the field continues to grow.
It does. And I think we are at the edge of that. I mean, just think about all the new kind of treatments that we can provide to our patients. It's just amazing.
Absolutely amazing. You're so right. And I think one of the reasons all three of us and many cardiologists have joined the field is really because how I love this world, multifaceted it is, just in terms of all of the things that you can do. And each different type of cardiologist can have a significant impact on their patients. So we're going to go a little bit deeper into your life as a social media guy. Obviously, you have a huge presence on social media, especially Instagram. You're always posting all of these really cool images and videos of the latest and greatest, especially in echocardiography. So how are you able to get started on social media, and what kind of advice would you give to students, trainees, and even early career physicians who want to utilize social media to advance their own careers?
Well, first of all, thank you. You're very nice. Yeah, this is kind of interesting. I started my own Instagram account in 2017, and this was thanks to the American Society of Echocardiography. So I was invited to give a couple presentations at the annual Congress in Baltimore, in Maryland, as I was included among the top 25 investigators during that year. And along with the invitation, they sent me this social media kit with suggestions and recommendations to make the best use of Instagram during the Congress. But the point was, I didn't have Instagram. So I downloaded the app, I called a few friends, and I asked them, how the hell does this work? I had Facebook, but I'd never used Instagram. And if you look at my very first post on Instagram, they have nothing to do with cardiology. They're all about underwater pictures, sharks, and all pictures that I had taken. And then all of a sudden you see pictures of the American Society of Echocardiography Congress. Then after that, yeah, that's how it went. I realized that as my subspecialty is echocardiography, I was in the best position to share what I do, to share what I love. I had so many images, so many cases, so many videos that could be of interest to students, to colleagues, to even people who are not in the field. So I started posting them, and then I had the huge honor to have them reposted by big guys on Instagram, like Cardiology on Call, Daniel Belardo, You're a Doc, Heartbeat Doctor, Amisha Gupta, Dr. Mohammed. And I mean, look at where we are right now. I am having the immense privilege to be interviewed by these two champions, Dr. Amisha Gupta and Dr. Amreen Mohammed. So, social media are a terrific opportunity for cardiologists. I am sure we have all learned from each other, or at least I have learned a lot. And we have the opportunity to see things that we probably will never see in person. Think about, for example, unique aspect valves. I have performed myself thousands of echoes and then never seen one firsthand. But people have shared it so many times that I'm sure that once I stumble upon one of those, it will be much easier for me to recognize it. But on another note, social media are just a media in the real original Latin sense of it. They are not intrinsically good. They are not wrong. It's all about us. It's all about the use that we make of them. Social media, for sure, are prompting a huge shift in the way medicine is perceived by the general population and the way evidence is spread, the way also misinformation is spread. The problem that comes with that is that the greatest enemy of knowledge is not ignorance, it is the illusion of knowledge. And I think we are the ones who have the tools and who have the moral obligation to point that out and help where we can.
Absolutely. I couldn't agree with you more. I feel like our role as physicians has really changed, especially over the past, few months and year with the pandemic. And really trying to fight misinformation and bring the right type of information to the general public. And it really is our responsibility. I feel like it's our responsibility to do so because there is so much misinformation out there, unfortunately. And just, to kind of further this, how do you think that other, trainees and students can utilize social media to, kind of help elevate their own careers?
And make an impact, Mm-hmm.
How to make an impact? Yeah, the first thing is stick with evidence. It could look like a very simple advice, but I think it's like the corner store. There's way too much misinformation on social media, and there's a lot of misinformation also from physicians. And we need to make sure that we are giving the right example. And if you do not stick with evidence published in very respected journal and high impact journal, solid data, then you are not doing you're not doing what you are supposed to do. And as you can start doing this as a trainee, you can start doing this as a med student. You can have a huge impact as a med student. There are med students on Instagram who have way more followers than I have, but mines are not that many. But there's med students who can have a huge impact on so many other med students or on other young people who can approach this world. So they can make the difference. But once again, I would say that my advice is stick to the evidence. And of course, on another side, you always need to make sure that you are delivering the message in the most appropriate way. If I'm writing something that of course, I don't know this in advance, but that I would like to be published in circulation, I know that I have to write in a certain way. If I'm writing something that will happen to be a post on Instagram, then of course my message needs to be delivered in a different way. So one piece of advice that I could give is you need to diversify your communication, the way you communicate things. And this needs to be tailored to the public that you want to reach. You want to send a message on social media on a platform like Instagram, which is accessible to everyone. Of course, you might be tailoring the message to other colleagues, but it has to be understandable also to the general public. So in that case, avoid using terms which are too technical. You should make it simple. At the end of the day, simplicity is the ultimate form of sophistication. So, and if you really learn how to do that, and I guess we are all learning how to do that, then you can really make the difference, and you can increase your audience.
Yeah, I think actually that's something that Einstein said as well, is that if you can describe something in a simple fashion, it's demonstrating that you have a high base of knowledge for that topic matter, right? And I think you brought up a very good point for all physicians and trainees is the lesson of learning how to diversify how we deliver that knowledge, right? Because I think that's important, not just in social media platforms, but also in our practice, right? Because, we're talking to colleagues where we talk in a specific language, and then we talk to families and patients, which is in another language. And so I think knowing that, how to do that, and maybe learning some tools from social media and from your colleagues on social media can possibly help you as a physician and provider in practice as well.
I could not agree more. I could not agree more. Yeah.
So I just want to ask also, because you did mention how you posted underwater pictures and then changed into, echo images, but you do also still post pre-pandemic, pictures of your life. And I do think it's important on social media to show, at least on certain platforms, Twitter, I think, is very academic in certain respects, and Instagram, like you said, is more global and more accessible to the general public, but to also portray kind of the realities of our lives as physicians, because it can be glorified or demonized in, TV and movies. And so to present that real side of medicine, and you do that in the sense of like a work-life fit. So can you talk a little bit about that for our viewers?
Yeah, sure. So work-life balance, that's what you're talking about. I guess the question is, are you able to create a work-life balance? It's very hard. But like, jokes apart, I have a lot of patients, including music. I play electric guitar. I used to have my own band back in those days. I like riding motorcycles, and most of all, traveling. Of course, I can't do it right now, and it's pretty frustrating. And I love scuba diving, shark diving, taking underwater pictures. The cool thing about these patients is that you need to reach pretty remote and far away places if you wanna do that. And the cool thing about that is that very often you have no internet connection available. No matter if you want to pay for that, there's no internet connection. For example, I recently, I mean, not this year, of course, the year before, I was in Tonga swimming with humpback whales, and there was no way you could have internet connection there. Or I went to see the Northern Lights. It was near the North Pole. There was no internet connection. And this, thanks God, forces you to black out for a while, turn off your phone, turn off your laptop. And once again, I think that I guess the bottom line is we need to draw a line. When it's time to work, you need to do your best. You need to excel, or at least try to excel in what you do, and that's your duty. But when it comes to taking a vacation, a much needed break, you need to be clear to everybody. It's your very own time, no cell phone, no laptop, and deaf people respect that. At the end of the day, it's in the interest of everyone. If we are happy, we are also more productive.
Mm-hmm.
Absolutely. And you bring up such a good point. I mean, work-life balance, is so incredibly important for every single person. But I feel like sometimes when, we're on social media, people think that we're available all the time, and I think they fail to realize we have full-time jobs that we're going to day in and day out. And then to do posts on Instagram and post stories and pictures and this and that all comes on our off time. And it can get very burdensome. And I'm sure that all of us have, really experienced that, especially within the past year when social media, we were utilizing it so much more. So we've had to create boundaries. Like, I know sometimes I get fatigued from social media, from seeing all these stories and thinking, what am I going to post and this and that, that I take breaks. I have to take break because your mind just starts going crazy. And if you don't do that, then, it can really cause a burnout.
Mm-hmm. Yeah, you are 100% right. I mean, sometimes I have people from like Australia or Bangladesh sending me EKGs or echoes and asking me, oh, what should I do? Is this medicine correct? And of course, I'm not going to reply to this. Like, I'm not going to give any kind of medical recommendation for a patient that I've never seen, that I will never see, and without having all the details that I need in order to establish the correct therapy. And I mean, this is just not going to happen. People sometimes do not understand that, and they try to push this thing to a point where when it comes a little bit annoying, it becomes a little bit annoying. But at the end of the day, you can just not reply to them.
Yeah. Well, I'm going to switch topic a little bit to diversity in the field of cardiology. And you have a unique position because you do travel and work between two countries, between Italy and the United States. And so you have a unique perspective. And how do you feel that we can further diversify the field of cardiology on a global scale?
This is a very, very interesting question. I think, first of all, that cardiology is not a field for everyone, but for sure it's not a field only for white males, just to make it clear. I would say that we need to diversify our field. This belongs to medicine, but it also belongs to cardiology in particular. And I mean, look at what you're doing. You are optimizing the field. You are helping with that. You should take credit for this. What you're doing is optimizing our field. You are sharing stories. You are sharing evidences. You are sharing knowledge. This is part of a revolution, and you are part of that change. And you should reserve credits for that. On a different note, one aspect that I would suggest talking about to optimize, to diversify, and probably more to optimize the field of medicine and cardiology in particular, is that so we do see that each single aspect of medicine is going toward an extreme level of specialization. We see this in cardiologists. They ask you, are you a cardiologist? Yes. Okay. But what do you exactly do? And then you say, I'm an interventional cardiologist. I'm an EP guy. I do cardiac imaging. And then they ask you, okay, but what in particular? And then you have to say, okay, I'm in advanced cardiovascular imaging. I do echo, or I do MRI, or I do CAT scan. I'm an interventional cardiologist, but I do structural, I do TAVRs, I do only coronaries, and so on. I mean, the examples are many. This is awesome, and we need that. We need people who excel in their specific field and people who we can rely on when we need them the most. But at the same time, to optimize our field, I think that we should never forget the bigger picture. We do not treat a vessel, we do not treat a valve, we do not treat an EKG. We are treating a person, we are treating a patient. So extreme specialization is cool. I'm part of that, you are part of that, and we need that. And we need to go through that path. But we should always keep in mind that we do not have to forget the bigger picture, the patient as a whole. I think this is a good message to share.
Yeah, absolutely. And I think that our patients come in different types, different faces, different backgrounds, and that the medical field as a whole should represent that, right? So not just as physicians, but as leaders in different specialties, that our patients should see representation in those who are treating them as well.
Yeah. Exactly. Yes, there's many papers being published right now, and we have a couple of them actually under revision. And we are looking at how underrepresented are women, for example, in cardiac surgery and cardiology in general, cardiac surgery also, but also female physicians. And I don't think this is in the best interest of anyone to keep anyone underrepresented. We need to have an equal representation of all the categories that we have. And once again, this is not just because we wanna we wanna say something nice. It's really in the best interest of everyone. I wanna be treated by the best, and I don't care if it's white, brown, black, if it's a male, if he's a woman, if it's gay, if it's straight. This just should not be part of the game.
Yeah, absolutely. And it's just unfortunate that cardiology specifically has just gotten such a bad rep for just being geared towards just a certain type of race, and gender. So, I think one of the reasons why Misha and I wanted to do this series was really to show that there is so much diversity within cardiology that you so nicely pointed out for us. And, we've been able to interview some incredible women, some incredible men that support women and different people of color. And then, like you also said, and like Anisha said, our patients look for that too. Like I've had so many patients that specifically just wanted to see a female cardiologist, or, because they feel like that person is going to understand them better. And it's very difficult. You see a lot of practices within the United States that are just, they just are male-based practices. And that can be very difficult for, let's say a woman or a person of color to go there and say, I can't really relate to what, you're telling me, or I can't put my trust in you because I don't think that you're going to understand where I'm coming from, or what socioeconomic background I'm coming from, or, what my, feelings as a woman, might be. So it's incredibly important to diversify the field, and also to put more people of color and women in positions of leadership, because we're really, really, really lacking in that as well, And so lastly, we want to, we've already mentioned your beautiful office that you have, that you're sitting in right now, that you're currently not working because it's a weekend, but you're still doing it. And so you clearly, you've started this practice at a very young age, and clearly it's growing and it's doing very well. So, and you're kind of also in this interesting dynamic where you're an assistant professor with an Ivy League university in the United States, but then also you have a private practice in Italy. So what kind of made you want to go this route of being in private practice? And if those people that, are about to start their careers are toiling with the fact of, going private versus academic, what kind of advice could you give them?
Yeah, you're right. Mine is sort of a hybrid approach to cardiology, private practice, and also the academic field. Private practice gives you that sense of autonomy, and also fulfills your desires of entrepreneurship. And of course, it's a huge. It comes with immense responsibilities, especially when you have other people working for you. Then on the other side, if you want to produce meaningful research, papers that can have a real impact on people's life, that eventually end up in high impact journals, you need to be part of a strong network. You need to be in the academic field. So long story short, I like both approaches and I could not choose between them. So I decided I would pursue both. And yes, I have my academic appointment at Weil Cornell, which is a tremendous honor for me. I also run my own private practice. So it's a lot of work and I constantly have to switch between two different time zones. But again, this tells you that it is possible. I have been working hard to make it possible. I am still working hard to keep it possible, but it is possible. I'm glad this happened, but once again, I'm here also because of the mentors that I've had, because of the people who have supported me, people who have pushed me. And if I can give a piece of advice, is that you should always surround yourself with people who push yourself, who challenge you, who force you to get out of your comfort zone, because that's where you grow. That's where you grow. And do it, and then later opportunities will come. You know, as Seneca used to say, luck does not exist. Mm-hmm. There's always the moment when talent meets an opportunity. So we don't know when the opportunity will come, but we can work on our talent and we can do it with passion. We can do it with passion. We need to work hard. We need to make it grow. We need to do what we love and do it with passion. And at the end of the day, you will see that the opportunity will come. The opportunity will show up. We just have to be smart enough to recognize that. Recognize it once it shows up and then take it. It happened to me with New York. My story with New York is a little bit of, you've seen the movie Sliding Doors, right? So I've had this terrible night shift during my fellowship years in Rome, and I was going back home and I was about to just black out and then sleep. But for some reason, I decided I would go to the gym that day. And while I was working out, I met Professor Mario Gaudino. Professor Mario Gaudino, he was a cardiac surgeon at my university, but already joined Weill Cornell. He already joined Weill Cornell, and the thing is that, long story short, he offered me a position at Cornell, a research fellowship there. So I said yes. I moved to Manhattan. I started working with him, and I met so many incredible mentors: Professor Gaudino, Professor Girardi, Jonathan Weinsaft, Professor Devereux, Professor Scubas. Those are all like big names in the field, and I've learned from them. I've learned a lot from them. We have published a lot, and then another fellowship came in advanced cardiovascular imaging. Then I stayed in New York longer than I was expected to. But the main point is that they've all supported me. They have all taught me so much. They are all successful researchers, devoted mentors, and skilled educators. I will not be where I am without their help, and I will never thank enough them for what they've done for me, and they still do for me.
Absolutely. I think, you made such great points throughout that, right? So I think the underlying message is that whatever you're passionate about, right? And we've talked about this before, is that continue with that passion, right? And opportunities will come as long as you put in the hard work and find, like you said, grab the opportunity when it does arrive, right? So just continue to follow your own path. And if you pursue that with passion, then things usually work out, right? Like, I'm not trying to sound, like a Hallmark movie or anything like that, because medicine is not a Hallmark movie. But at the same time, like you said, I think that we're all very passionate about our careers, and many physicians have said this, where, if they're pursuing this for the right reasons, the right opportunities will come.
I am 100% convinced of that. Yes.
And I love that story of you saying that you were like dead tired after your shift and you just decided to go to the gym randomly and would have never expected that this incredible opportunity with this Ivy League medical school would have even come your way had you not gone to the gym. I mean, if people don't believe that things happen for a reason, I mean, that's a story to break that,
That's another reason to convince people to have a good lifestyle.
Yeah.
work out, go to the gym.
Go to the gym.
Yeah,
3
okay.
cardiologists are telling you to go to the gym.
You never know what's going to happen at the gym.
It sounds like a good story, but it is a real story. I mean, probably I wouldn't be here talking to you if this didn't happen.
Oh, well, hopefully the gym's memberships will go up post-COVID, and we can see some more opportunities at the gym.
All thanks to you. All thanks to you and your story.
I don't think so, but it's very nice for you to say that.
Well, Antonino, we have had the best time talking to you. You're so easy to talk to. You've been such a pleasure. You've given some amazing pearls and on life advice and career advice. So do you have any lasting words that you'd like to give our audience before we go?
Well, I think we have already talked about this, but the point is, I would live with this sentence. Luck does not exist. Grow your talent and opportunities will come.
Absolutely. Absolutely. We couldn't agree with you more. And what greater words to part with than those. So again, thank you so much for joining us. It was such a pleasure, especially on a weekend. It's storming in Sicily. Hopefully the storm passes and you can make it safe.
It's storming. It's kind of strange, but it's unusual, but right now it's storming.
And hopefully we can all hang out soon, post-pandemic. We're really looking forward to it. And thank you again to our audience for joining us on IGTV and YouTube. And we look forward to seeing you guys soon. Bye.